My name's Gail. I've come into Dr. Adams for a couple of months because of knee pain that I experienced. I could not go up and down steps, and at work when I had to get up and down, I had so much pain that I couldn't hardly walk. And at this time, I don't experience that pain during the day, and I can go up and down steps. So I've seen a lot of improvement, and looking forward to that. I can exercise and walk and even do some knee bends now, so it's been good.
My name is Julia. When I first came to Dr. Adams, I was in so much pain with my knees, and my knees were swelling. I was walking with a cane, could barely even walk for about 15 minutes, or stand no longer about 10 to 15 minutes. And after coming to Dr. Adams and start doing the therapy that he has me on, my knees are no longer swollen. I don't have the pain anymore, because I used to have pain even at night. I would be in so much pain I couldn't even sleep. But now I feel great. I'm able to go and do some things that I wasn't before. I love shopping. I'm able to get out and shop and go visit some of my friends and go to church service. Just enjoy life. And I am happy with my results.
Well, before I came up, I had a lot of knee pain, and if I squatted down in the floor, well, I couldn't get up. I had something else that I could get a hold of, but luckily in what they've done here, I can get up and down now without doing that, and go up and down the steps without a lot of pain.
Hi, I'm Janie. I came to see Dr. Adams through a newspaper ad, and I was walking part-time with a walker, part-time with a cane, and since he has treated me for the last 3 months, I have done away with my walker and my cane. Have very little pain. I have none in my left knee at all anymore. I have none in my my left wrist. My left wrist was almost paralyzed to a certain extent for about 22 years. And now I can close it and make a fist, which is remarkable for me. I just can't say enough about the treatment here. Everybody has been very pleasant, nice, helpful. I couldn't ask for any better treatment. And if anyone can't understand, then they need to just make that first phone call and call, because it's well worth the money and the time and the effort. They'll help you any way they can.
Okay, this is Terry Campbell. Today is June 25th, and we're going to be doing some shoulder range of motion. So the first thing is, Terry, tell me a little bit about what happened to the left shoulder.
I had a torn labrum, had that repaired January 10th, 2013.
Okay, and then we did laser on it. How long after that?
About a week maybe.
Okay.
Somewhere around a week you started the laser.
And then you went through physical therapy from?
From about a week and a half after surgery until mid-April.
Okay, so let's start out. We'll do both arms. We're going to do abduction, so I'm going to have you bring both arms up over top of your head. Make sure your palms are facing out. You got it right. There you go.
Okay.
Mm-hmm. And that's good. Drop them down. Now I'm going to have you turn and face the wall to your left. And I want you step towards me just a little bit and do external rotation with both arms.
At the same time?
Yeah. Okay, and now turn and face the opposite wall. We'll do the same exercise. All right. Okay, and you can stop. Very good. Now turn and face the wall behind you. Reach over top of your shoulder and try to put your hand between your shoulder blades with the right arm first. And now with the left arm. Okay, and now from underneath, reach behind and try to put your hand between your shoulder blades. Right arm first. And now left arm. Okay, very good. And all right, so this is Terry. We're just a couple minutes after the procedure. It's June 25th. So Terry, what I want you to do is go ahead and raise your arms up over your head, out to the side with palms facing out. Any pain? Very good. Turn and face that wall. Do external rotation with both arms, please. And back. And now turn to the other side. And arms up. External rotation. And back. So still a little bit of work to do there. All right. Compared to when we first started, better, same?
Oh yeah, better.
Okay. Reach, turn around, face the wall, I'm sorry. Go ahead and with your right arm, touch between your shoulder blades from the top. And now do the same thing with the left arm. Okay, and back down. And now with the right arm, do it from behind. Sorry.
Oh, sorry.
That's okay. And now with the left arm. Okay, and back down. All right, you can stop. Ready, you can go.
That's it.
That's it? Okay, go ahead and drop them down. Very good. And today is June 24th. This is Mr. Wilson. This is Mr. Wilson, June 24th, post-procedure. So go ahead, palms out, and bring your arms above your head, please. Straight up, just like you did.
Without bending my elbows.
Without bending your elbows. Awesome.
About it.
All right, this is Mr. Everhart. Mr. Everhart, can you tell us a little bit about what's been going on with the arm and the shoulder?
Well, for about 6, 7, 8 months, my shoulder's been out of place and my nerves hurt all in my shoulder so bad I can't stand it up at night time. And when I lift my arm, I can handle it low, but when I get up, I gotta lift it up because it hurts so bad I can't. And I can wiggle it around while it's up, but when I let it back down, I just relax it and let it back down with the other hand. And I guess this has been going on for a long, long time. Well, he would tell you, hey, he fixed it. He gave me one treatment, and what all he done, I don't know, but he put a lot of pressure on my arms, and I had to breathe and all. And when I got up, all my muscles had relaxed, and I hadn't had no pain in 2 days, because I was up here 2 days when he done it, and I've slept good at nights, and I go around and show everybody how I can raise my hands up. When he started with me, he asked me to raise my arms, and I could do like this, and I couldn't get them up. They wouldn't go up. And now it's a world of difference.
Are you happy with the results? Are you happy with the results?
I'm very happy with the results. And if my wife and daughter is so tickled because I walked around with my head down like this to get so my nerves would relax, and they called me, they kept hollering at me, "You're gonna walk like an old man if you don't quit it." But that was the only way that I could relieve my muscles, my nerves, and so now I walk around and sometimes I'll strut because I feel so good about it.
Well, that is awesome. Well, we appreciate you. We're talking to Pam. Pam's come in with right shoulder pain. So tell us a little bit, how was the shoulder this morning as far as range of motion and pain level?
Well, very difficult to bring my arm across in front of myself. I have a hard time pulling a shirt off. As long as it's kind of hanging to the side, it doesn't hurt too bad, but I can't really do too much if I have to bring it across in front of myself.
Okay. And on a scale of 1 to 10, 10 being the worst, how much pain did you have with movement this morning?
When I came in, it was probably 3, 4.
Okay. And then we did a 60-second cold laser treatment on it, and right after the laser, how would you say the shoulder was?
Probably a 1 or a 2.
And how is the range of motion?
I can bring it almost completely across. Well, I can't bring it all the way across. It's much better.
Good. And was that the first time you ever had laser?
Yes.
And what do you think? Do it again?
Yes, definitely.
Very good. Thank you very much.
Yes.
Hi, my name is Gerald Church. I'm at Dr. Adams' office. I've had heel pain and plantar fasciitis for roughly 20 years with constant pain every day in varying degrees. I've had two treatments with the cold laser, and currently as I stand I'm pain-free, but within a few days, it'll be a lot less, if any, comes back. So it's one of those things that's hard to explain, but it's nice to not have that constant pain in your feet every single day.